NCLEX RN Actual Questions and Answers 2026 to boost your confidence. Question 1. Among the following components of a thorough pain assessment, which is the most significant? Option A. Effect. Option B. Cause. Option C. Causing factors. Option D. Intensity. The correct answer is option D. Intensity. Pain is subjective. The client's self-report of pain intensity, using a scale, is the most significant component for directing treatment. Question 2. A 65-year-old female is experiencing a flare-up of pruritus. Which action could aggravate the condition? Option A is sleeping in a humidified environment. Option B, daily baths with fragrant soap. Option C, using clothes made from 100% cotton. Option D, increasing fluid intake. The correct answer is option B, daily baths with fragrant soap. Fragrant soaps and frequent hot baths dry the skin and cause irritation, significantly worsening pruritus, itching. Question 3. A client with bacterial pneumonia is admitted to the pediatric unit. What would the nurse expect the admitting assessment to reveal? Option A, high fever. Option B, non-productive cough. Option C, rhinitis. Option D, vomiting and diarrhea. The correct answer is option A, high fever. Bacterial pneumonia in children usually presents with a sudden onset of high fever, along with a productive cough and respiratory distress. Question 4. The nurse is caring for a client admitted with epiglottitis. Because of the possibility of complete obstruction of the airway, which of the following should the nurse have available? Option A, intravenous access supplies. Option B, a tracheostomy set. Option C, intravenous fluid administration pump. Option D, supplemental oxygen. The correct answer is option B, a tracheostomy set. Epiglottitis is a medical emergency. The nurse must have emergency airway equipment, tracheostomy or intubation set, at the bedside in case of sudden closure. Question 5. A 25-year-old client with Graves' disease is admitted to the unit. What would the nurse expect the admitting assessment to reveal? Option A, bradycardia. Option B, decreased appetite. Option C, exophthalmos. Option D, weight gain. The correct answer is option C, exophthalmos. Exophthalmos, bulging of the eyes, is a classic finding in Graves' disease caused by inflammation of the extraocular muscles and fatty tissue behind the eye. Question 6. The nurse is providing dietary instructions to the mother of an 8-year-old child diagnosed with celiac disease. Which food selection indicates understanding of the instructions? Option A, ham sandwich on whole wheat toast. Option B, spaghetti and meatballs. Option C, hamburger with ketchup. Option D, cheese omelet. The correct answer is option D, cheese omelet. Celiac disease requires a gluten-free diet. Eggs and cheese are naturally gluten-free, whereas wheat toast and pasta contain gluten. Question 7. The nurse is caring for an 80-year-old with chronic bronchitis. Upon finding an O2 sat of 76%, which of the following actions should the nurse take first? Option A, notify the physician. Option B, recheck the O2 saturation level in 15 minutes. Option C, apply oxygen by mask. Option D, assess the pulse. The correct answer is option D, assess the pulse. When a monitor shows a critically low value, 76%, the nurse must first assess the patient's physical status, pulse/circulation, to determine if the reading is accurate or if the patient is in distress. Question 8. The doctor performs an amniotomy on a gravida 3 para 0. Which observation would the nurse be expected to make after the amniotomy? Option A, a fetal heart tones 160 bpm. Option B, a moderate amount of straw-colored fluid. Option C, a small amount of greenish fluid. Option D, a small segment of the umbilical cord. The correct answer is option B, a moderate amount of straw-colored fluid. Normal amniotic fluid is clear or straw-colored. Greenish fluid indicates meconium staining, and a cord segment indicates a prolapsed cord, emergency.